Hello, I'm Dr. Linda Parker, urologist and educator in men's health. Today we're going to explore a question that a lot of men ask, but rarely get a calm, science-based answer to. What actually happens if you don't ejaculate for 30 days? You'll hear strong opinions on both sides. Some say abstinence supercharges energy and focus. Others worry it's unhealthy for the prostate or mood. You deserve a balanced, compassionate explanation that respects both your biology and your goals. By the end of this guide, you'll understand what's likely to change, what probably won't, why some men feel shocking shifts, and how to do a 30-day reset safely if you choose to try it. Let's start with the most common expectation: testosterone. Many men imagine that avoiding ejaculation for a month will send testosterone soaring. The best summary is simple and sometimes surprising. Baseline testosterone in healthy men tends to remain within its usual range, with day-to-day fluctuations driven more by sleep, stress, weight, and exercise than by ejaculation frequency. There was a small study years ago suggesting a blip around day 7, but larger, better controlled data have not shown sustained testosterone boosts from abstinence alone. If you feel stronger or more driven during a 30-day challenge, it's usually because the challenge changes your routine. Better sleep, more gym consistency, less late-night screen time, fewer ultra-processed foods, not because abstinence itself acts like a hormone injection. The practical takeaway is empowering. If your goal is steady vitality, protect the pillars that actually move testosterone: resistance training, adequate protein, sunlight or bright light exposure in the morning, and real sleep. Now let's talk about seminal parameters. What changes inside the system? For fertility labs, the recommended abstinence window before a semen analysis is usually 2 to 7 days. That window strikes a balance: too short, and volume or count may read artificially low. Too long, and quality markers like motility and DNA integrity can trend downward for some men. What does that mean for a 30-day abstinence period if you are not actively trying to conceive? In everyday life, it rarely matters. Volume will build to a point, and then your body uses a safety valve. Nocturnal emissions. These automatic releases are healthy, common, and simply your body's way of cycling old material. If you go a full month without any release, you might notice heavier seminal volume and thicker consistency when you eventually do. That isn't dangerous. It's just physiology doing its job. What about the prostate itself? You've probably heard two contradictory ideas: that frequent ejaculation protects the prostate, and that holding back helps it rest. Observational research has found that higher lifetime ejaculation frequency is associated with a lower risk of future prostate problems, but association is not proof of cause. The most honest position is measured. Staying sexually inactive for a month is unlikely to harm a healthy prostate, and ejaculating regularly over the long term may be one of several lifestyle factors linked to a healthier prostate profile, alongside weight management, movement, and an anti-inflammatory pattern of eating. If you're over 50 with urinary symptoms like weak stream or frequent night urination, those changes are usually driven by prostate enlargement, hydration timing, caffeine, medications, and pelvic floor tone, not by whether you went 30 days without ejaculating. Now the question most men are shy to ask: will not ejaculating for 30 days cause pain? It can cause discomfort in some people. The medical term many men use informally is blue balls, and the clinical description is epididymal or pelvic congestion: temporary, harmless pressure from prolonged arousal without a release. Not everyone experiences it, and its intensity varies. It resolves with time, warmth, gentle movement, and, if your personal plan allows, with ejaculation. There is no evidence that this temporary discomfort damages the system. However, if you feel sharp pain, persistent one-sided swelling, fever, or pain with urination, That's not congestion. Those are red flags that require evaluation. Now to the nervous system. Abstinence challenges often change mood, focus, and energy, and this is where many shocking results are felt. Some men report more clarity, better drive in the gym, deeper focus at work, or more creative momentum. Why would that happen if testosterone doesn't skyrocket? Because your habits shift. Many men doing a 30-day reset also change media consumption, cut down on late-night scrolling, add morning sunlight, or build a consistent training plan. The nervous system loves structure. Fewer novelty-seeking spikes at night mean more dopamine availability for daytime tasks, which feels like more willpower. It's less about stored fluid and more about stored attention. On the flip side, some men feel more irritable in the first week or two. That usually isn't withdrawal. It's the brain adjusting to fewer easy hits of stimulation. The solution isn't white-knuckling, it's replacing stimulation with regulation, breath practice, walks after dinner, and earlier sleep. What about sleep and nocturnal emissions? If you abstain for 30 days, there's a good chance your body will schedule its own maintenance. Many men have an automatic release during REM sleep, especially in week 2 or 3. That's normal at any age. It does not mean you failed. It's your biology doing housekeeping. If that happens and your personal challenge defines abstinence as no voluntary ejaculation, you're still on track. If your definition is zero release, then know that fighting your own circadian physiology often leads to frustration. Choose a definition that supports your mental health, not one that turns the month into a shame trap. Let's address pelvic floor dynamics because they are quietly central to comfort. The pelvic floor is a group of muscles that support the bladder, prostate, and bowel. When you spend long hours sitting, brace your abdomen during stress, or hold your breath while lifting, those muscles can remain in a subtle on position. Over time, that tone can become your default, leading to a sense of heaviness or pressure. If you combine a tense pelvic floor with abstinence, you may notice more awareness of that area, not because abstinence caused a problem, but because attention amplifies sensation. The fix is simple and gentle. Diaphragmatic breathing, hip mobility, walking, and a few minutes of relaxation before bed. When the diaphragm moves freely, the pelvic floor reflexively cycles between gentle engagement and release, which is exactly what you want during a 30-day reset. Now we'll move from theory to a practical, safe plan. If you decide to do 30 days without ejaculation, let's set clear goals. Protect your mood, support your prostate, and exit the month feeling more centered, not deprived. Start with a baseline checklist. How many times do you wake at night to urinate? How is your stream? How do you feel most afternoons, steady, flat, or wired? How many workouts do you complete per week? How many nights do you scroll late? Write those down. You'll reassess on day 30. Week 1 is stabilization. Expect your mind to search for old cues. Replace them with a new sequence. Finish your last glass of water at least 3 hours before bed. Eat a lighter dinner than lunch. Take a 15-minute walk after dinner. Dim screens 60 minutes before bed. Do 5 minutes of belly breathing in a chair or lying down. Sleep in a cool, dark room. That routine alone improves night comfort for many men over 40, regardless of anything else. Week 2 is redirection. When an urge hits, you don't argue with it. You redirect it. Do 20 push-ups against a wall, 10 air squats, or a brisk 2-minute walk. Then hydrate with a small glass of water if it's earlier than evening. The goal is to teach your nervous system that strong energy can be moved, not suppressed. If you work at a desk, set a timer to stand every hour. Tight hip flexors tug on the pelvis and amplify awareness of the region. 2 minutes on your feet breaks that loop. Week 3 is strength and sunlight. Add 2 or 3 resistance sessions, simple full-body movements, push, pull, hinge, squat, at a level appropriate for your joints. Get outside in the morning for light exposure. The combination tunes circadian rhythm, steadies hormones that influence mood and body composition, and makes the month feel purposeful rather than restrictive. Week 4 is mastery and review. You're not pushing harder, you're practicing smoother. Keep the evening routine, keep your walks, keep breathing. Add a brief reflection before bed. What felt easy today? What triggered me? What helped me shift state without a release? This is where you harvest the real benefit, self-knowledge that remains after day 30. Let's be specific about nutrition because it shapes circulation and comfort. Favor a plate that reduces inflammation and supports vascular health. Lean proteins or legumes, colorful vegetables, olive oil, nuts, berries, and adequate hydration earlier in the day. Limit heavy, late meals and minimize alcohol, which commonly disrupts sleep and increases night bathroom trips. Caffeine is fine earlier, but taper after lunch if you have nocturia. If you want a direct support for circulation that is gentle and food-based, think about adding watermelon or beets during the week, natural sources that support nitric oxide pathways. You're not aiming for perfection. You're aiming for a calmer internal climate. Now, some men approach a 30-day challenge for spiritual, behavioral, or focus reasons and feel genuinely better. More time, more presence, less guilt around media. Honor that. The benefit there is about attention and values alignment. Other men try abstinence and notice more tension, more irritability, or pelvic discomfort. Honor that too. Biology is diverse. You're not broken if your body prefers a regular rhythm that includes release. If your goal is improved vitality, the best outcome is the one that makes you more stable, kind, and effective, not the one that wins an internet badge. Let's address a handful of common questions concisely. Does a 30-day abstinence prevent prostate cancer? No. Prostate health is multifactorial. Long-term patterns, weight, movement, diet quality, family history, matter far more than a single month's choice. Can abstinence cause prostatitis? No. Prostatitis is a broad label for inflammatory or infectious conditions. Abstinence doesn't cause infection. Some men with chronic pelvic discomfort do report symptom changes with their arousal and release pattern, but the driver there is pelvic floor tone and nervous system sensitivity, not simple days since last release. Will my performance decline after 30 days? Most men return to their usual function quickly. If anything, men who practice nervous system regulation and stop tying their self-worth to performance often do better afterward because they bring less pressure and more presence. If you are over 50 and navigating urinary changes, add these 4 micro-habits regardless of your abstinence plan. Hydrate early. Most of your fluids before mid-afternoon. Protect sleep. A consistent bedtime and wake time support hormone rhythm. Move daily. Walking and light strength work for circulation and mood. Talk to your clinician about medication side effects, especially decongestants and some antihistamines that can worsen urinary flow. These details improve comfort far more than arguing with your biology. There are red flags that are not part of a normal 30-day experiment. Seek evaluation if you have burning with urination, visible blood in the urine, fever or chills with pelvic pain, sudden inability to urinate, painful swelling of one testicle, or new severe back or bone pain. Those are not adaptation. Those are signals that need professional attention. If you're in a relationship, frame this month as a communication opportunity rather than a secret challenge. Explain that you're testing a reset to improve focus and well-being. Emphasize that closeness and affection remain important. Many couples find that a month of non-goal-oriented affection, walks together, longer hugs, shared dinners without phones, actually deepens connection. You are training your nervous system to value presence over pressure. That carries forward whether you continue abstinence or return to your usual rhythm. Mindset decides whether the month is a burden or a builder. If you call it deprivation, your brain will rebel. If you call it a focus block with clear start and finish lines, your brain will organize around it. That's why we wrote a plan and set measurable markers. On day 30, take 5 minutes to compare notes. Did your sleep improve? Did your afternoon mood stabilize? Did your number of workouts increase? Did late-night screen time drop? If the answers are yes, then the month served you, regardless of how often you plan to release in the future. If the answers are no, you still learned something important. Your body prefers a different rhythm, and now you can pursue vitality through sleep, training, and nutrition without tying it to an abstinence rule. Before we close, here is a simple evening routine you can adopt tonight, with or without a 30-day plan. Finish fluids 3 hours before bed. Eat a lighter dinner than lunch and take a 10 to 15-minute walk afterward. Put your phone away 1 hour before bed. Sit comfortably, one hand on your chest and one on your abdomen. Inhale through your nose for a count of 4. Exhale for a count of 6 for 5 minutes. Keep your room cool and dark. If thoughts about performance or rules intrude, remind yourself. Your worth is not tethered to any metric. You are practicing steadiness. That practice pays dividends in the morning. Here's the one line I want you to remember when the noise gets loud. Your biology rewards calm consistency more than extremes. If a 30-day reset helps you build consistency, wonderful. If a regular, balanced rhythm helps you feel at home in your body, that's wonderful too. You're not choosing between health and happiness, you're designing a routine that honors both. If this conversation brought you clarity, take a moment today to write your baseline notes and set a simple plan for the next week. If you know a friend who could use a grounded explanation instead of internet myths, share this with him. And if you want more calm, evidence-informed guidance on men's health in midlife and beyond, subscribe so we can keep building a community that treats your health with respect and practicality. Educational content only. This is not a diagnosis or a treatment plan. If you have persistent urinary symptoms, pelvic pain, fever, or any red flag signs we discussed, seek in-person evaluation. If you are making changes to medications or have specific health conditions, coordinate with your clinician.